and as Rowie pointed out, heartbreaking stories in war zones around the world. And war is more than just the wounds suffered on the battlefield and people forced to flee their homes. It's also those who are left behind and then overlooked. I spoke to Dr. Kate Tulenko, Vice President for Health Systems Innovation at IntraHealth International.
Yes, medical organizations like Medicine Sans Frontiers are set up mainly to do emergency care and also now increasingly primary care, but we forget that large percent of the populations will have chronic disease or diseases such as cancer. And in fact, cancer is one of the most complex diseases to treat. In fact, cancer is not just one disease, it's literally hundreds of different diseases with different treatments. And if you were to have a refugee camp with about 10,000 adults, every year you would expect 45 people to be newly diagnosed with cancer. So that, in a refugee camp of 10,000 people, it's not enough to set up an oncology center, but there are options such as, telemedicine or tele-oncology.
Is that possible, even somewhere like Syria or Yemen?
Well, in Syria or Yemen, if it's an active war zone, it's actually much more complex. But once people are in a safe area, telemedicine could be set up. Cancer isn't something that general practitioners normally treat, but they can, in conjunction with oncologists and specialists in a remote area, they can provide treatment.
But who's going to provide this? Because, people are used to donating food and short-term medicines and bandages, but these are people who have busy lives, dedicated healthcare professionals having to take time out and follow up on patients they may never see.
Yeah. Well, I think increasingly the World Health Organization and other global organizations are trying to set up permanent bodies to respond to crises, because it's not when even if the next crisis occurs, it's when. And so having people on standby, in fact, the WHO now has a permanent registry of healthcare workers who are available on standby.
Yes, you almost need red helmets as well as blue helmets, the peacekeepers as well. Is this partly a result of wars going on longer, more refugees, more civil wars that are intractable?
Yes, there are now more refugees than any other time since World War II, and so that's why you're seeing part of this problem. Also, we have more treatments now for some of these diseases. 50 years ago, if you had cancer, you just died, but now there's the hope of cures. In fact, leukemias, childhood leukemias, are 95% curable with proper care. So, so that's where the tragedy occurs.
Do we have any figures on how many people are affected by long-term diseases when it comes to coping with their illnesses in war zones?
Well, for cancer, there's a 40% lifetime risk of someone developing cancer. And for other diseases such as high blood pressure or diabetes, often 50% or more of adults will get those. So if you're an adult, you can pretty much expect you're going to get a chronic disease unless you take extremely good care of yourself.
So this would happen to literally tens of thousands, if not millions of people in cities like Aleppo and Homs, in parts of Iraq?
Yes. And some of the conditions, such as high blood pressure and diabetes, are a little bit easier to treat. They're basically primary care. The challenge is with the specialty care, such as cancer or orthopedic surgery or cardiac surgery, that really requires specialty physicians, specialty nurses, really a whole team around the patient. And one thing for your viewers to keep in mind is all of us are really just a Superstorm Sandy or Hurricane Katrina away from being displaced. And so people with chronic diseases should keep a notebook, detailing their diagnoses, their treatments, and have at least a month's supply of their medicines nearby, so that if there's an emergency, they can grab those and leave with them. And there are now some commercial products available where you can put an electronic medical record for yourself on the web that would be available globally, or some people wear it, as a bracelet or wear it around their neck. So those are available, but of course, mainly to middle and upper income people.
It's quite incredible that in the midst of war and tragedy, there is still hope for long-term illnesses with these new developments. Thank you so much for joining us.
Thank you.
If you like what you just saw, follow us on social media and visit our website, CCTV-America.com.